you'll see that the talk is divided according to levels in the temporal bone. It's something that I decided to do years ago before computed tomography and magnetic resonance imaging. We needed to look at the temporal bone with plain X-rays, and also tomograms, pluridirectional tomograms were used to blur out things in front and behind the plane in the image that you wanted to see. And therefore, the anatomic structures in the plane that you wanted to look at were sharper and not overlapped. And we'll talk about an old article that described using different planes in the coronal plane to approach the anatomy. And once we started doing computed tomography of the temporal bone in the late 70s, the transverse axial plane was imaged for the first time. So we needed to learn the anatomy in that plane, and I found it easier to go from top to bottom in the temporal bone. So the A plane, the O plane, the P plane, and the V plane are actually transverse axial planes that we'll use to go through not only the anatomy, but also a pathology that is usually seen best at those levels.